Hi, Dr. Milky back with another foot message for you. I've probably done over 100 of these videos, and I'm not sure I've ever talked about bursitis. And you might have heard of bursitis. People get it in their hip. Um, some people think it's just an old person's thing, and it's certainly not. A bursa is a sac or a sac-like cavity that can be fluid filled or not, that are around joints. So I'm out here on the outside of the foot, little toe, and right here near what's called the fifth metatarsal bone is a common area for bursitis. People will come in with some like swelling in this area, and they'll think they have a bunion, what we call a Taylor's bunion on the outside of the foot, when in fact it's actually inflammation of the bursa, the sac that's over that area. Now, typically that can come from certain activities, shoes, pivoting, driving. There's a number of different things that can cause inflammation of that sac. So oftentimes what we need to do is get that inflammation down, sometimes with a simple cortisone shot, which works almost every time. Sometimes it's just wearing shoes that are a little bit wider, maybe certain activities where you avoid putting a lot of pressure on that part of the foot. Rarely is surgery indicated for something like that. Sometimes there can be a Taylor's bunion, so the bone can be a little bit bigger out here, just like you get a bunion on the inside of the foot, you can get a bunion on the outside of the foot. But you can get bursitis in a number of different areas around joints. We see it on the inside of the foot where there can be a bunion here. You can get a bursa there. It can happen in a number of different areas. Back here in the Achilles area, you can get a bursitis problem. One of the most common ones, though, in the foot is out here by the fifth metatarsal bone. And if it's something that's just been there for a while and it's just not going away with doing, the typical home remedies, then you got to come in, have it looked at, and we'll figure out exactly what we're dealing with. We'll take an x-ray to make sure there's not a bone problem or a stress fracture or something else, and then do whatever we can to get that pain to go away quickly. Thanks for watching again. See you next time.